Hello, my name is Levan Ujawam, and today at Georgian National University, it's SEU, with partnership of a 3D Organon, I will present you the circle of Willis. I will talk about the structures, I will talk about the functions, and make a simple overview of a circle of Willis. The circle of Willis is a loop of arteries at the base of your brain. Its function as the for two major arteries that supply blood to your brain. It can play a role in minimizing effect of a brain's issues. Let's make an overview of the circle of Willis. What does it do? It is a ring or pentagon-shaped structure, as we can see, of arteries located at the base of the brain. It's where the two essential blood flow circulation from your brain connects: the internal carotid artery and the vertebral artery. We can see here internal carotid artery and the vertebral artery. The internal carotid arteries supply fresh oxygen-rich blood to the most of the front of your brain. These vertebral arteries do the same for the most of the back of your brain. The complete circle of Willis functions as fail-safe. If one of these two blood vessels pathways become damaged, such as, for example, due to the brain aneurysm or stroke, the other pathway can still provide blood flow to the affected part of your brain. Now let's talk about also a little function of circle of Willis, to understand the function of circle of Willis, I will show again pointed to the structures. Now imagine that each of the arteries that make up the circle of Willis, the two main highway, we can say, provide the most of the oxygen and blood flow in the brain. This internal carotid artery and vertebral artery, the other small roads of the circle of Willis from the branches of these arteries. So, to ensure that these arteries have a proper blood flow to the brain areas, they have a connection. For example, if there's an accident, we can say, or damage in of the main artery, the other arteries can help to move the blood flow to specific area of the brain. This complete the branches and the internal carotid arteries, vertebral arteries, communicative arteries also help. For example, if there's a blockage to one area, other part of this Willis circle will help to make a blood flow to specific brain tissues to not get damaged the brain tissues. Now let's talk about most important and interesting part, the anatomy. The circle of Willis sits on a base of your brain in a space just outside the brain tissue. We can see it surrounded the stack of your pituitary gland just below the hypothalamus. We can see also here the part that is the pituitary gland, and around that there is a circle of Willis. Now let's talk about the anatomy. We have here the anterior communicating artery, a short vessel which connects the two anterior cerebral arteries. Also anterior cerebral artery, the branch of the internal carotid artery. Also we have an internal carotid arteries that continues after the contribution of the circle of Willis as a middle cerebral artery. Also posterior communicative artery connects the internal carotid and posterior carotid arteries and posterior cerebral arteries, terminal branch of the basilar artery, and we can see here the basilar artery, which is formed by the union of the vertebral arteries. So once again, we know that circle of Willis gives the rise to numerous vessels which supply the cerebral and cerebellum. This can broadly be divided into the anterior circulation and posterior circulation. So anterior circulation, we have anterior cerebral artery, anterior communicating artery, and mid-cerebral artery. And the posterior circulation, posterior cerebral artery, and posterior communicating artery. For example, back then I was talking about that if there's a one kind of obstruction, the other part will provide our brain with oxygen. So for example, let's imagine there's a blockage of anterior communicative artery. It can also cause dysfunction of our, for example, if it's affecting our right side of our brain, it can have affection of left side of our hand and left side of our leg. So if there's a again obstruction of anterior communicating artery, the brain can often still receive the adequate blood supply from collateral circulation. It's dependent in some cases, but mostly yes. This collateral circulation will provide the specific brain area with oxygen, and also will revive the parts that is affecting, for example, our cognitive functions and also our movement functions. This was the overview of circle of Willis, simple anatomy, also simple function of circle of Willis.